You might think signing up for Medicare is just like getting car insurance. You shop around for the lowest prices, make sure that you find a good premium, you kind of move on and set it and forget it and move on with life. I'm here to tell you that if you're wrong. If this is your strategy, you're walking into a expensive financial trap. So here's the truth. Medicare is not logical. It's a maze of government deadlines and private insurance loopholes, where a single checkbox in the wrong place can cost you thousands for a lifetime. I've seen smart, successful people drain through their savings because they've made one wrong assumption when they turn 65. So in this video, I'm going to walk you through the top 5 most expensive Medicare mistakes in 2026. Welcome to Medicare Uncomplicated. I'm Sebastian Correa, a local health insurance broker here in Ocala in the Villages, Florida. Mistake number 1, this is a very common one, is when you're first eligible for Medicare that you have time to enroll and you want to think some options through. The clock is ticking. You really have that 7-month window, 3 months before your birthday, the month of your birthday, and then 3 months right after your birthday to make that decision. And believe it or not, because they think they have a whole year, they end up enrolling in a 10% penalty in that Part B. Don't wait for your birthday cake. Enroll 3 months before. Second mistake is, I'm employed. I'm working for an employer. I'm going to stay working. I have health insurance. I don't need to enroll in Medicare. Always look to make sure that your employer has credible coverage. If your employer has less than 20 employees, very likely you do not have credible coverage and you will incur penalties if you try to enroll in Medicare. Another huge misconception is that when people retire, they get the option for COBRA. COBRA, it is not considered credible coverage. So you must sign up for Medicare if you are retiring. Mistake number 3 is set it and forget it. The set it and forget it trap is also very common. Most people that enroll in Medicare, kind of like the car insurance scenario, you set it, you forget it, and you don't have to worry about it. It's not the same thing with Medicare. Part D, which is a prescription drug plan, every year potentially can change their formulary. So if you're taking a prescription in a certain plan and you think that it's going to be the same every year going forward, I'm here to tell you it's not. Loyalty does not pay in Medicare. Keep in mind, every year between September and October, you get an annual notice of change. And that is to tell you if anything in your Medicare plan has changed that's going to affect you. If it is, it's super important that you take the advantage of the annual enrollment period to make changes for next year. So mistake number 4 is actually the gamble on the network. And it kind of goes back to mistake number 3. Sometimes if you're in a Medicare Advantage plan, you don't have necessarily changes to the plan. The copays might be the same, but the network, your doctors might change. So the annual notice of change will actually detail if there's been a change in network as well. And if your doctor's not in network and you have an HMO plan, you have no coverage to see that doctor. You're paying 100% out of pocket. So this is why I tell people, look at your insurance. The doctor comes first, the plan comes later. Mistake number 5 is the smart trap. And this is where people say, well, I'm healthy now. I'm not gonna be healthy later. I'm just gonna get a Medicare supplement plan when I get older and I probably have more comorbidities, versus now getting an Advantage plan since I really don't have any costs and I'm okay to pay as I go. Well, I'm here to tell you that's not gonna work. When you are first eligible for Medicare, any of these insurance companies, they don't look at your health. You have 1 year where they're gonna just accept you for your health and what you are. And if you get a really good plan, you can stay in that plan. However, if you are eligible for Medicare Advantage plan when you first turn 65 and you stay in that plan for just 2 years and you have a heart attack, other things happen, and now you want to switch to a supplement plan, the likelihood of any insurance carrier underwriting processing going through and accepting you is very unlikely. You're actually going to end up having to stay on a Medicare Advantage plan and potentially keep those costs high. In this time, what you can do is do the opposite. Enroll in a supplement plan now if you could afford it. Down the line, if you feel like you want your budget's tight and you want to go to Advantage plan, you do have 9 months to try an Advantage plan and then go back without any medical underwriting. With any of these mistakes, I feel like most people don't realize that any decision does have a consequence and it potentially can result in a penalty. Also, any decision that you think might feel right has a consequence later. Well, this is why it's good to have a trusted broker on your side that's going to tell you and confirm that if your decision is correct or not. You see, a trusted local broker, health insurance broker that's unbiased will basically not decipher whether Medicare Advantage is better versus Medicare Supplement. Somebody like myself, I've seen clients have a situation where a supplement plan is more suited for them, and I've seen where an Advantage plan is more suited for others. And in the next video, I will compare and contrast the difference between a Medicare Advantage plan and a Medicare Supplement.